I'm going to talk to you today a little bit about how to set up a PanBio clinic and how to perform the PanBio testing. And a lot of the experiences that I have are in relation to a large-scale validation study that we were working on in long-term care. So that's where we've developed some of our ideas around process. So we'll talk a little bit about how to get things set up as far as what's in the kits and how to set them up. Recommendations around staffing requirements, because I know that's a big question people have. What kind of space you require. Talk a little bit about biosafety, and then of course, as a lab person, my favorite topic, quality control. So yeah, so when we think about readiness for setting up a clinic, so you know, you need the kits themselves to do the testing. It's important to, whenever you receive any kind of reagent, check the expiry date. You know, these tests should not be performed until, like, if you're keeping them in the fridge, don't use them until they come to room temperature. So I would recommend not even storing them in the fridge, to be honest. They don't need to be stored in the fridge. I would just store them at room temperature, so you don't have to worry about this. If you are storing them in the fridge though, and then you bring them to room temperature, don't put them back in the fridge. That's an important point. You're gonna want to have some sort of rack or something that you can put the PanBio tubes in. There is a cardboard rack that comes with the kit, so you can sort of grab one out of one of the other kits so that you've got enough for the tubes you have. You want to create procedures for how to perform a test so that everybody performs the testing in the exact same way. And in there, you want to include information about quality control and quality assurance parameters that we'll talk a little bit about later. We recommend that you have 2 to 3 team members trained to operate this clinic, and we're going to talk a little bit more in detail about the kind of staffing model that we recommend. But so I'll get to that a bit later. Of course, confidentiality agreements, whatever that looks like in your home. And you want to have a dedicated space where you can do this testing. Not that it needs its own room, but you want you know, a dedicated table, a spot that's a bit off by itself from high traffic areas, where you can set up your PanBio tests so that it's kind of off on its own. Yeah, just to allow for concentration and sort of from an infection control point of view. So as far as extra materials that sort of don't come with the kits, you should be wearing full PPE when you perform this. So, you know, face protection, eye protection, like a mask. We recommend a gown, gloves. You're going to need biohazard waste containers. There is a lot of biohazard waste with PanBio testing. All the little cartridges and tubes are considered biohazard waste. We recommend that you have printed labels, which I'll talk a little bit about, for each participant that you're testing, just to allow for you to keep track of results, especially if you're doing a large number of tests at once. Gloves, hand sanitizer, staff list. A timer is really important so that you can time. These tests have to be read at a certain time after they've been set up, and so you want to have a timer for that. You're going to want to have disinfectant wipes or 70% alcohol. And we do recommend, if at all possible, a plexiglass shield that you can do the testing behind. It's not absolutely required, but we do recommend it just as another stage of protection. So the kits, the PanBio kit itself, there's a little foil pouch that the actual testing cartridge is stored in, and it also, there's a little pouch of desiccant in there. So when you're opening up the PanBio package, give it a shake so that goes to the bottom. Otherwise, you get beads everywhere, which we've experienced. You've got the extraction tube. So that's, I don't know if you can see my mouse, but that's the extraction tube there. You've got extraction tube caps. These come separate. You've got the swabs themselves. We'll talk a little bit about that later. A bottle of buffer, just a liquid. This is the liquid buffer that does the extraction from the swab. You've got a positive control swab, a negative control swab, which we'll talk about. The tube rack that I mentioned, a quick reference guide, which is helpful, and then a full instructions for use. So yeah, so the swab type. So most of the inventory right now come with nasopharyngeal or nasal swabs within the kit. The NP swabs that come in the NP kit can be used for NP, deep nasal or combined throat and both nares specimen collection. And then the nasal swabs can be used for deep nasal or the combined throat and both nares. So if you want to do NP swabs, you need to specifically request the kits with the NP swabs. As I mentioned, you should store these at room temperature. Don't put them in the freezer. So yeah, don't put them in the fridge at all. It's between 15 and 30 degrees. So yeah, don't put them in the fridge. Don't put them in the freezer. Always check the expiry date. Make sure that the kit hasn't expired. Once you've removed the little cartridge from its foil pouch that I mentioned, then you need to use it immediately. So if you open one and then you don't need it that day, for example, you'll have to discard that. You can't use that later. And again, if the foil pouch is at all damaged or the seal's been broken when you go to use one, don't use that one either. They have these kits often have humidity requirements and things. You don't want that to be an issue. So yeah, so this is where we talk a little bit about the staffing. So we recommend that ideally you would have 2 to 3 designated staff members for testing. Again, the experience that we've had is in sort of large clinics that have been set up for pan biotesting, where you're testing a large number of individuals at a time. So you could tweak this depending on how many people you're going to be testing or what your particular setup is. But this is what we recommend, and this is what's worked quite well in the homes that we've worked with. So 3 people. So person A, who can be this could be like an administrative assistant or a clerk. It doesn't have to be a healthcare professional. And this person sort of would help prepare the PanBio kits. It's really helpful before you're doing testing to have kits prepared for this. And I'll show you a picture of what we include in the kits a bit later. And then it's also, you want this person to be able to sort of register the staff members that you're testing. If you're using labels, what we recommend, label the tube for the staff, with the individual's label with their name and whatever other information you want for tracking that particular person to make sure that their test and their swab are all kept sort of together. That's why we recommend creation of these kits so you don't get mixed up. Person B would be the person actually collecting the swab specimen. And we'll go through how to do that and placing that in the extraction tube. So that person should be a healthcare professional. And then person C would be the person actually performing the PanBio testing and recording the results. And that person should also be a health professional. So again, I mentioned having some dedicated space. So it doesn't have to be its own room, but it's nice to have sort of a closed off area for doing testing. It could be behind a divider. It could even be in the corner of a room. It's just nice to have that dedicated space. And you're going to want a table. Here is recommended 6 to 8 feet. Some kind of table that's easy to clean, easy to wipe down. You're going to want to wipe that with, with the wipes or the 70% alcohol very often. It's nice to have a place to do the swabbing that's a bit separate so that that's a bit more privacy for the person being swabbed. You also, of course, want to, as much as possible, have physical distancing of people running the clinic. You want to make sure you have an on-hand supply of the PPE and the test kits. And of course, you need to think of a process. So if you end up with a positive result on the PanBio, what's your process? Who gets contacted in that situation? So this is just a picture of Jennifer, who's the point of care technologist who's been doing a lot of this testing in here in Ottawa. And this is just her setup. You can see she's got the plexiglass shield. She's got 3 batches of PanBio tests set up in front of her. She's got the rack there. And she's got this bucket off to the left-hand side there. And that's where we recommend you have some kind of bucket that the person who's doing the swabbing can put the swab that's ready to be tested, the little kit, in that bucket ready for the tester as part of the process. You can see that there. We do recommend that you do conduct a local risk assessment for this testing, looking at all stages of the testing to figure out if there are risks in your environment that you need to mitigate. Again, it's really important to wear PPE. So you'll see in a couple of slides what the actual test look like, but in that extraction tube, you've got that buffer that you're putting your swab in. And there's no indication that that buffer inactivates the virus if it's present. So you can consider that buffer to potentially contain, you should consider that buffer to contain live virus, essentially. That could, if you spill it or you get it on your hands, that's a biohazard risk. So you need to be, wearing PPE all the time, changing gloves, and keeping the area very clean with this testing. It's important that you dispose of the specimens, so the swabs, the kits, the cartridges, in an appropriate biohazard container, and that you have a way of dealing with biohazard waste on site in order to maintain a safe work area. So quality control swabs. So you'll notice that each kit of 25 tests comes with one positive control and one negative control swab. And these just help you to know that the tests that you have are performing as they should. So the recommendation in the onboarding guide is if you are going to be performing more than 25 tests a day, so more than one box of tests, then you should perform quality control testing before the day of testing begins. So at the beginning of each day, if you're going to be doing more than 25 tests on that day. If you're doing less than that, so you should then do it every time you open a new box, which is easy to remember because each new box is going to have its own quality control swabs in it. We would also recommend that every time you receive a new shipment from Ontario Health, you should perform quality control. It's really important to make sure that nothing happened to that kit in transport. This is something we do in the hospital all the time for point of care. We perform quality control testing on everything that comes into the hospital because we don't know what happened between the time we ordered it and the time that we received it. So it's really important to validate that. And when you should track the lot numbers of tests that you're, of test kits that you're receiving, and when you receive a new lot number, also important to do quality control. So my advice is just do quality control every time you receive a new shipment. Take a look at that shipment, make sure it's all the same lot number. If there are 2 different lot numbers, I doubt that would happen very often, but it could. Then I recommend doing quality control on both of those lot numbers. It's really important that we stick to the timing for these tests. So they need to be read between 15 and 20 minutes for the patient test, and the control at 15 minutes is important. If you leave it much longer than that, you can get inaccurate results. So for performing quality control, you can see it's very similar to performing a patient test, which is ideal when you're doing quality control. You always want it to mimic your process for doing patient testing as much as possible, because you're not just testing that kit to see if it works, you're also testing your entire testing process. So you want it to mimic what you're doing, what you would be doing for a patient. So you see you have your, you put the buffer in the tube, so you're putting there's a line on these extraction tubes. You need to fill it up with this dropper bottle to that line. And you can place your tube in the rack. You'll insert your quality control swab, swirl it around 5 times. Then you really want to squeeze that quality control swab and pull it through your fingers as you're squeezing it. That allows the sample to come off the swab into the buffer. Put the blue cap on, and then you're going to take this bottom cap off, the white cap off, and you're going to do 5 drops onto the test cartridge, and then you're going to time that for 15 minutes and read it. So a positive result, so for any test to be valid, you have to have where that C is, that's called control, and that's the line that has to be positive for a test to be valid. And what that's doing is that's making sure that there was enough sample, that's making sure that the test itself worked properly as it should. So you want to make sure that's always there. If it's not there, it's invalid and you have to start over again. A positive result will have 2 lines. It'll have the control line and the test line by T. A negative result is just the one control line, and that's it. So if you have any situation where you don't have a control line, the test is considered invalid. So this slide goes through what I just talked about. So see the first example, you have a control line and no test line. So that's good. The test is valid and negative. Second one, you have a control line and a test line. So that's good. You've got your control line. So that test is valid, and you've got a test line indicating a positive result. You can see the next example, and we have seen this happen where you can get a control line that's quite strong and the test line that's somewhat weak. This is also a positive result. and should be called a positive result. And you can see this sometimes, and it's really careful when you're reading, especially if you're reading a large number of tests at once. It's easy to miss these faint ones, so just be wary of that. We have seen that. And then you can see the other examples below. You can see here there's no line. Then that means it's invalid, right? Anytime you don't see that control line, it's invalid. And then there you see there's a test line but no control line. Again, that's an invalid result. So now I'll talk a little bit about setting up the clinic itself and some of the preparations you can do and the steps in performing the pan-bio testing in the clinic environment. So yeah, so we'll talk about the preparations that you can do before the clinic starts, sort of registering patients or participants. I like to call them patients, but really it's your staff that you're testing, so not really patients, participants. Collecting the specimen itself, reading the results, and communicating the results. So in the kit, what we recommend is you take a biohazard bag, and that in there you pre-fill. I think there was a question in the chat just now about pre-filling these extraction tubes. Yes, we absolutely recommend that. If you can pre-fill that with the up to the line, and you'll see when you look at it, the line, you can fill it up to the line and have that ready to go as long as it's capped really well and won't leak. I don't think there's a time limit. I think I would say whatever expiry date is on the bottle itself, I would use the same expiry date for how long you can have those pre-filled. But you wouldn't want to do it super far in advance. I would recommend doing it a day or two in advance. So we recommend putting a pre-filled extraction tube, the test kit itself, and a swab in that bag, and then that's the kit that you use for each individual. And then we recommend that you print out, if you have a way to print out labels for your participants, which I imagine a lot of places do, because that's probably what you've been doing for PCR testing. We recommend that you print out 3 labels. One goes on the extraction tube itself. One is used by the tester to put on the cartridge when they're testing, and another one is used on a results tracking sheet, just so that you can keep track. And we have some pictures later, but that way it allows you to keep track of that specimen. So yeah, we recommend that you have a staff member that kind of takes care of this intake process, takes care of registering and sort of keeping track of who's been tested. This person could label this this tube, the pre-filled tube, and we recommend put the extra 2 labels inside the test kit, so that you've got those labels specific to that person. And then we recommend that kit be given to the person being tested, and then they take it over to the swabbing station. So then specimen collection itself. So again, you have one individual dedicated to swabbing, and then they can they receive this kit with the pre-labeled tube from the individual being tested. They perform the sample, whether it's an NP swab or a triple site, whichever you decide to do, and then take that swab, put it into the buffer, swirl it around 5 times, and then really what we found really important, you need to squeeze that tube and kind of draw the swab through it to allow the sample to go into the buffer, break off the top of the swab, close up the extraction tube. And then it's ready to be taken over to I would recommend putting that back in the biohazard bag, taking that over to the person who's going to be doing the testing. So this is what we recommend for batch testing. So here you can see we've got a test tube rack, biohazard bag, gloves, of course, timer, and then a result. I mentioned this results sheet. So what we recommend is exactly what's set up here. So when you put the patient's or the participant's label on their actual test so that you can keep track of it, and then number that, and then put that second label that you have on the results tracking sheet and also number that. And so that those numbers match. And if this was your batch of tests, let's say it's a batch of 2, then you could set your timer. Once you get those 2 set up, set your timer for 15 minutes. And then you could write beside on the sheet of paper here, like what time that's due at. Or if you're using a timer that has multiple timers on it, you could say, okay, timer number 1 is for these 2, just so that you can keep track, especially if you have multiple batches being set up at once. So we recommend setting up batches of 5 or 10, depending on how many tests you're doing at once. That's why we recommend using the labels so that you can keep track of whose cartridge is for who. The process for testing is that the individual doing the testing will label the cartridge, and then they will take the extraction tube that has the swab in it, and they will pipette or squeeze out 5 drops into the appropriate spot on the cartridge, and then put the cap back on. You can either keep that tube until you have your test result. There's rarely enough to repeat a test in there. We don't really recommend using the same tube anyway. We recommend a new specimen for repeats anyway, so you can just dispose of that in the biohazard waste. So you can do that for each of 5 to 10 specimens, whatever you're comfortable with. That's what we recommend. And then start your timer for 15 minutes once you've got those 5 set up, and then you can start a next batch, which obviously requires having potentially multiple timers, or keeping track of it, somehow keeping track of the time for each batch. You can get timers that have multiple ways to time on them, which can be quite helpful. That's what we've been using. You can get bubbles in the extraction tube, which can be a problem. So we recommend, sometimes you can't get enough drops out of it with that. So we recommend just sort of very gently sort of shaking that to release a blockage. I know Jennifer also found sometimes she had to invert the tube just a bit, because sometimes the swab itself would get stuck in the hole where the buffer should be coming out. So that can also be another trick. If there's any spillage at any point, or you get anything on your gloves, it's really important. You should be changing gloves between each specimen anyway. Just important to keep that in mind. And of course, it's really important to clean up any spills, because I mentioned there could be live virus in that spill. So here's another picture of that testing station. So you can see there we've got 3 batches of tests set up. Got our bin there for our specimens, timer, and then the results sheet. I blocked it out because there's obviously patient data on there, but that's what's behind that black box, is our results recording sheet. So after 15 to 20 minutes, then the person who's doing the testing can interpret each cartridge. If you read beyond the 20-minute point, the test is invalid. It needs to be read between 15 and 20 minutes. We talked about what a positive result looks like, what a negative result looks like, and what an invalid result looks like, and that's reviewed again on this slide. You need to dispose of the device and the swab and the cartridge, the extraction tube in biohazard waste. And then what we recommend is you have like that results sheet that I showed you right at the testing station, where you can record each person's result as negative or positive, and then that can be entered later into the spreadsheet, however you're keeping track. That would be what we would recommend, rather than having a laptop right at the testing station, just from an infection control point of view. So I mentioned that if the control line isn't there for any reason, that's considered an invalid test. We recommend that you collect a new specimen and repeat that again, and really review your procedure, just to make sure that it's being performed appropriately. We would say if you get invalid results for your qualities controls and for your participant specimens, that you need to file this concern with Ontario Health. And I would say on your day of testing, if you get invalid results with your quality control, that you should not perform testing, and so you figure out what the problem is with the tests. So if it's if someone has a negative result, it's really important to remember that with these are screening tests, and so false negatives they will occur. And so it's really important that no one have a false sense of security with a negative result. Negative results should be treated as presumptive negatives, and everybody should still continue to follow public health measures for symptom screening, appropriate social distancing, use of PPE, hand washing. None of that should change. You can report the negative results to the staff being tested, of course, but again, with the caveat that nothing should really change as far as their practices related to public health measures or PPE. So it's important that you have a process set up. Who should positive results be communicated to in the home, and the individual who had a positive result, that needs to be communicated to them, and it needs to be communicated that this is a preliminary positive result, and they need to be instructed to have a confirmatory PCR test within 24 hours. So yeah, this just sort of talks about responsibilities around communication. So again, whoever's performing that testing, the actual pan-bio testing, needs to know who they should be communicating positive results to so that they can be followed up on. I think the next slide just talks about available resources and support. So you put that up, and then I think then it's some time for some questions.
So our questions around the use of PPE, and specifically, Dr. Shaw, I know you addressed this, but maybe if you could speak more to the importance of changing gloves between each person being swabbed and between each cartridge being tested.
For sure. Yeah, I mean, I think it's just really important. I mean, from the swabbing perspective, you wouldn't want to, if you tested, so if you collected a swab from someone, you certainly wouldn't want to keep the same gloves on when you swab the next person, because if that person had tested positive, then you could potentially pass that on to the next person. And I think that I would hope that that's a common practice now. As far as the testing goes, because there's always a chance that your gloves can become contaminated through the testing process, it's really important that you change gloves between specimens so that you don't accidentally contaminate the next testing device, for example, which would cause you false results potentially.
Great, thank you. Going into more specifically quality control testing, question here on if it's required to test both the positive swab and the negative swab each time you're doing the quality control check.
Yes, that's what's recommended.
Okay. Is it okay to have the buffer pre-poured into the tubes and capped on the rack so it saves time? And Dr. Shaw, I think you spoke to that, but I'll let you add to that.
Yeah, we definitely recommend that. I think it can really speed up your processes the day up. So yeah, I would recommend a day or two before getting your tubes prepared.
I'm wondering if Dr. Shaw, you could comment on the importance of squeezing the swab. I think you touched on this in your presentation.
Yeah, I think, it's recommended in the package insert as well for the test. And I think the real importance is because the samples can sometimes be a little bit viscous, it really just by squeezing it and kind of pulling the swab through your fingers, you release the sample into the buffer is what we've found. And I think that's why they recommend it.
Great, thank you. Okay, and this might be a question for you, Dr. Shaw, again, as well as Bryson. And the question is, can we conduct the clinic similar to how we are currently doing our surveillance testing, but just now operate it 3 times a week? Any recommendations on how the facility can conduct clinics to capture all of the staff in testing 3 times a week?
I think that is an option to set up this. That's how we've been training anyways. We've been coming into sites and coming in on the day where they do their, one of the days, if it's that they do their screening of all their staff, and have really been training that sort of like this is an additional step. So, so yeah, so just adding on that testing piece in addition to the swabbing that would have happened previously. So I do think taking your current process and kind of adding this on and then multiplying it, which I recognize is no small task, I think that probably is a good place to start. And then as far as I think just thinking around how you're going to manage people coming on site that aren't staff, for example, visitors and people that need to be tested, that outside of those clinic hours potentially, just sort of thinking through that and whether you have somebody available on site who can do a test should someone arrive at the door and require testing, somebody who's trained on all shifts, for example, who could come down and do that, depending on the volume. If it's a couple of people during a shift, that's probably more doable than if it's a steady stream of people coming in, obviously.
Okay, thank you. That's helpful. I'm going to switch a little bit now and dive into some of the clinical questions that we've received. And maybe we'll start with a question around the variants of concern and whether or not the PanBio is able to detect the virus if it is one of the variants of concern. Dr. Corbet, are you there?
Hi, everyone. Thanks, Rebecca. That's a great question. We know that, in essence, the PanBio should be able to detect the variants of concern. What we know is that the PanBio detects a protein called the nucleocapsid, which is different than the protein that is most often associated with the variant of concern mutations, which is the spike protein, which is on the outside of the virus, whereas the PanBio detects what's inside the virus. So kind of a difference from a science standpoint. And this has been proven with some studies that were done in the UK and with the Public Health England team in the UK that looked at testing most of their UK variants with the PanBio, and it performed well. So in terms of the UK variant, we're not concerned. In terms of the other variants, we know anecdotally that the Brazilian variant has been tested on PanBio and worked in Brazil, but we have no final wording or evaluation report that can formally address this. But we're not concerned that it would be missing these variants. And then for the other variants, including the South African ones, we haven't seen any evaluation either for those, but from a theoretical standpoint, there shouldn't be any concerns, at least currently with our knowledge of the principle of the test itself.
Thank you. Okay, we also have some questions around the swab type, Dr. Corbet, and wondered if you wouldn't mind addressing those. The current inventory in Ontario is the kits that have the NP swab and kits that have nasal swab, with the majority of them being, I believe, the NP swab kits. And in terms of placing an order, when you place the order, there's no need to make a mention of what type of kit you prefer, because those will be distributed based on supply. If there is a preference at your organization to have NP swabs, it's at that time that you would need to make that note and request specifically the NP swabs. Dr. Corbet, there is a question around the use of the NP swab to perform the anterior nasal combined with throat, and wondered if you could speak to that.
Sure, that's another great question. The difference between the PanBio nasal and the PanBio nasopharyngeal swabs is the difference in terms of the size of the swab itself. So the nasopharyngeal swab has a very small tip, whereas the nasal swab has a bigger tip. When you use a nasopharyngeal, because of its small size, to go deeper in the nose, you're able to capture more viruses. So here, that's why the nasopharyngeal swabs are usually recommended to capture the most virus as possible. The more you go lower down the nose with the smaller tip of the nasopharyngeal swab, the less virus you're going to be able to capture. So if you use a nasopharyngeal swab with a small tip and you swab the anterior nair, the anterior side of the nostrils, you won't be able to capture as much virus as if you were to use an actual nasal swab that has a bigger tip that would be able to capture more viruses with the bigger tip. So that's why currently the nasopharyngeal swabs are to be recommended for use with nasopharyngeal collection or a deep nasal collection, also known as a mid-turbinate collection, or another alternative method, which is kind of as sensitive or close to being as sensitive, which is the combined throat and dual nair method with the nasopharyngeal swab to gather as much virus as possible. In the future, when the nasal swab will be available, then the nasal swab, which has the bigger tip, may be appropriate for use with the nasal collection.
Great, thank you very much.